stop taking your blood pressure pills this way after 60. And before anyone misunderstands me, I am not telling you to stop your medication. Do not stop your blood pressure medicine on your own. That can be dangerous. What I'm telling you is this: after 60, the way you take that pill matters far more than most people were ever told. The time you take it, what you drink with it, what other over-the-counter pills you add on top of it, what you do when you miss a dose, and whether your blood pressure is actually controlled while you sleep can make the difference between real protection and a dangerous gap you never see coming. I am Dr. William, and I want to have the conversation that should happen more often in the exam room. Because millions of adults over 60 take blood pressure medication every single day, faithfully, responsibly, exactly as the label says, and yet they still do not understand what that medication is doing inside their body. Amlodipine, losartan, lisinopril, metoprolol, hydrochlorothiazide, furosemide. They know the instruction printed on the label. Take once daily, take with water, take in the morning. But what most people are never told is that those instructions are only the beginning, not the whole story. After 60, your body is not processing medication the same way it did at 40. Your kidneys filter more slowly. Your liver clears certain drugs less efficiently. Your arteries become stiffer. Your balance system becomes less forgiving. Your blood pressure follows a stronger and sometimes more unpredictable rhythm across the day and night. And that means a routine that looked harmless 10 years ago can quietly become a problem today. I think of a man I will call Robert, 72 years old, retired accountant, careful, organized, the kind of person who never missed a pill. Every morning at 7:30, he took his blood pressure medication with coffee. If he forgot it, he sometimes took 2 later because he thought he was catching up. He also took his water pill with dinner because the bottle simply said once daily, and dinner was the easiest time to remember. On paper, Robert looked compliant. In real life, he was waking 3 times a night to use the bathroom, getting dizzy on the way back to bed, and carrying morning blood pressure readings that made no sense. One night, he fell in the hallway. He did not have a stroke. He did not have a heart attack. But he fractured his wrist. And when we reviewed his routine, the problem was not that he ignored his medication. The problem was that nobody had explained how to take it safely in an aging body. That is what this video is about. Not fear, not stopping medication, not replacing your doctor. This is about 5 common blood pressure medication mistakes people over 60 make every day, often while trying to do the right thing. Stay with me until the end, because mistake number 1 is the most important, and it is the one that may completely change what you ask your doctor at your next appointment. Before we begin, tell me in the comments, how old are you? And do you take your blood pressure medication in the morning, at night, or at different times depending on the day? I read the comments, and your answers help me understand what this community is actually dealing with. Let us start with mistake number 5, taking your blood pressure pill with coffee and then trusting the number you see afterward. Now, I know coffee feels harmless. For many people, it is the first comforting ritual of the day. But caffeine is not neutral. Caffeine stimulates your nervous system. It can temporarily raise blood pressure, increase heart rate, and make the body more alert. For a healthy young person, that may not matter much. For a 68-year-old with stiff arteries, a beta blocker, and a home blood pressure cuff sitting on the kitchen table, it can create confusion. Think of your cardiovascular system like a car. Some medications, especially beta blockers like metoprolol or atenolol, are trying to ease the pressure on the engine. They slow the heart rate and reduce the force of each beat. Caffeine, at least temporarily, pushes the accelerator. So if you swallow your medication, drink 2 cups of coffee, and then check your blood pressure 30 minutes later, you may be measuring the caffeine surge more than your true baseline. Some people also feel palpitations and assume the medication is failing, when the real issue is the timing of the stimulant. I am not saying everyone on blood pressure medication must quit coffee. That is not realistic, and for many people, it is not necessary. What I am saying is this: separate your pill and your coffee. Take the medication with a full glass of water. Give it at least 45 to 60 minutes before your first strong cup of coffee, especially if you have palpitations, arrhythmia, anxiety, or morning blood pressure spikes. And if you are checking your blood pressure at home, do not check it immediately after coffee, exercise, arguing, rushing, or climbing stairs. Sit quietly for 5 minutes, feet on the floor, back supported, arm at heart level. Same arm, same time, same method. One random number after caffeine is not a medical story. A consistent pattern is. Mistake number 4, taking a diuretic too late in the day. Diuretics are often called water pills. These include medications like furosemide, hydrochlorothiazide, chlorthalidone, and others. They help the body remove extra fluid and sodium, which can lower blood pressure and reduce strain on the heart. They can be extremely useful, but the timing matters. If you take a water pill late in the afternoon or at dinner, it may reach its strongest effect while you are trying to sleep. That means your bladder fills at midnight, 2 a.m., or 3 a.m. You wake up. You stand up in the dark. Your blood pressure shifts. Your balance system is sleepy. Your legs are not fully awake. And in an older adult, that is exactly when a small timing mistake can become a serious fall. This is not just about inconvenience. A nighttime bathroom trip after a diuretic can combine several risks at once. Lower blood volume, dizziness when standing, poor lighting, slower reflexes, and stiff joints. That is why many clinicians recommend taking once-daily diuretics in the morning, and if a second dose is prescribed, taking it earlier in the day rather than near bedtime. Your doctor may have a specific reason for a different schedule, so do not change it without asking. But if your bottle says once daily, and you have been taking it at dinner because that is when you remember, that is a conversation worth having. Ask this directly. Should my water pill be taken in the morning to reduce nighttime urination and fall risk? Also, ask what to do if you are sick with vomiting, diarrhea, fever, heavy sweating, or poor fluid intake, because dehydration can change how these medicines behave. That is called a sick day plan, and far too few older adults have one. Mistake number 3, adding healthy foods, supplements, or drugstore pain relievers without realizing they can interact with your blood pressure medication. This is where careful people get into trouble, because they are often trying to be healthier. Let us start with grapefruit. Grapefruit and grapefruit juice can interfere with the way the body processes certain medications, including some calcium channel blockers such as amlodipine, nifedipine, and felodipine. The issue is an enzyme system in the gut that helps control how much medication enters the bloodstream. Grapefruit can block that system. When that happens, drug levels may rise, and the result can be dizziness, flushing, swelling, or blood pressure dropping too low. This does not happen with every medication in the same way, but you should never guess. Ask your pharmacist one simple question. Does grapefruit interact with my exact blood pressure medication? Not my friend's medication, not the general category. My exact pill. Next, salt substitutes. Many people with high blood pressure are told to reduce sodium, so they buy low-sodium salt substitutes. Some of those products replace sodium with potassium chloride. That can be a problem if you take an ACE inhibitor like lisinopril, an ARB like losartan or valsartan, or certain potassium-sparing diuretics, because those medications can raise potassium levels in some people. Potassium is essential for the heart, but too much potassium can disturb the heart's electrical system. Symptoms may include muscle weakness, unusual fatigue, tingling, nausea, or an irregular heartbeat. But sometimes there are no obvious symptoms until levels become dangerous. So if you use a salt substitute, electrolyte powder, potassium supplement, or high potassium meal replacement shake, tell your doctor and pharmacist. Do not assume natural means safe. Chemistry is chemistry. And then there are NSAIDs, the pain relievers many people take for arthritis or back pain, like ibuprofen or naproxen. These can raise blood pressure in some people, reduce the effect of certain blood pressure medications, and strain the kidneys, especially when combined with ACE inhibitors, ARBs, or diuretics. I am not saying you can never take them. I am saying they should not be invisible. If you take them often, your doctor needs to know. The medicine cabinet and the prescription list are not separate worlds. Your kidneys see all of it. Mistake number 2, doubling up after a missed dose, skipping doses when the number looks good, or using blood pressure pills like rescue medication. Blood pressure medications are not like aspirin for a headache. They are not designed to be taken emotionally, reactively, or randomly. They work best when they maintain a steady presence in your system. A missed dose can matter. A double dose can matter. Skipping because today's number looks good can matter. Taking extra because one reading scared you can matter. This is one of the most common patterns I see. Someone checks their blood pressure and sees 158/90. They panic. They take an extra pill. 2 hours later, they feel dizzy, weak, or faint. Or the opposite happens. They check one morning and see 118/72, feel proud, and decide maybe they don't need the pill that day. Then, the pressure rises later when they are no longer watching. Both reactions come from the same misunderstanding. A single reading is not the whole truth. Blood pressure moves all day. It rises with pain, poor sleep, caffeine, stress, a salty meal, exercise, dehydration, anxiety, and even the act of being worried about the measurement itself. What matters is the pattern. If you miss a dose, follow the instructions for your specific medication or call your pharmacist. Many medications specifically warn not to take 2 doses to make up for one missed dose. But the exact advice depends on the drug, the dose, and how close you are to the next scheduled dose. Do not invent your own rule in the kitchen at 10 p.m. Make the rule before you need it. At your next appointment, ask, what should I do if I miss this medication? What if I remember it late? What if my reading is unusually high? What number means I should call you? Write those answers down. Tape them inside your medicine cabinet if you need to. That is not overreacting. That is adult medicine done properly. Now we arrive at mistake number 1, assuming morning is automatically the best time for every blood pressure pill after 60. This is the mistake hiding in plain sight because it feels so normal. Most people take medication in the morning because that is how the routine was built. Wake up, coffee, breakfast, pills. But blood pressure does not run on a flat line. It follows a rhythm. In many healthy people, blood pressure dips during sleep, then rises in the early morning hours as the body prepares to wake. That morning surge is one reason strokes and heart attacks often cluster in the early part of the day. But after 60, many people stop dipping normally at night. They may be controlled in the doctor's office at 10 a.m., but uncontrolled at 2 a.m. They may have beautiful daytime readings and dangerous nighttime pressure. They may be, as I tell patients, controlled at the wrong time of day. This is where the science is important, and we need to be honest. Some earlier research suggested that taking certain blood pressure medications at bedtime could significantly reduce cardiovascular events. But later, large research, including the TIME study in the United Kingdom, did not find a major overall difference between morning and evening dosing for everyone. So the answer is not, everybody should switch to bedtime tonight. That would be too simple, and it would be unsafe. The real answer is personalization. The best time depends on the medication, the person, the side effects, the fall risk, the kidney function, the sleep pattern, and whether that person has nighttime hypertension or a non-dipping pattern. Diuretics are often better earlier in the day because of urination. Some people get dizzy if they take medication at night. Some people need morning dosing because that is when they will remember it consistently. But some people, especially those with high nighttime pressure or morning surges, may benefit from moving certain non-diuretic medications to bedtime under medical supervision. The only way to know is to measure the full pattern, not just one office reading. That is where ambulatory blood pressure monitoring comes in. This is a small monitor you wear for 24 hours. It checks your blood pressure during the day and while you sleep. It can reveal white coat hypertension, masked hypertension, nighttime hypertension, and non-dipping patterns that a clinic reading will completely miss. If your blood pressure is hard to control, if your morning readings are high, if you wake up with headaches, if you have kidney disease, diabetes, sleep apnea, dizziness, or unexplained fatigue, ask your doctor, would a 24-hour ambulatory blood pressure monitor help us understand my real pattern? That one question may be more useful than simply adding another pill. I think of a woman I will call Eleanor, 79 years old, retired music teacher. Her office readings looked acceptable for years, but she woke up tired. Her morning numbers were often high, and she had a family history of stroke. Her doctor finally ordered a 24-hour monitor. The result was eye-opening. Her blood pressure was not dipping at night. In the early morning hours, it climbed sharply. Her physician did not stop her medication. He did not double everything. He adjusted the timing of one medication, kept her diuretic in the morning, improved her evening routine, and tracked the results. 3 months later, her morning pattern looked calmer. Eleanor told me, "I thought I was taking my medication correctly for 10 years. I was taking it faithfully, but not intelligently." That is the whole message of this video. Faithfully is good. Intelligently is better. So here is your action plan. Tonight, do not change your medication on your own. Instead, write down the name of every blood pressure medication you take, the dose, the time you take it, and what you usually take it with. Add your over-the-counter medications, especially ibuprofen, naproxen, decongestants, sleep aids, electrolyte powders, potassium supplements, and salt substitutes. Add grapefruit juice if you drink it. Add alcohol if you drink it near your dose. Bring that list to your pharmacist or doctor and ask for an interaction review. Second, if you take a diuretic, ask whether your timing is correct and whether you need a sick day plan for dehydration, vomiting, diarrhea, fever, or heavy sweating. Third, if you drink coffee in the morning, separate it from your medication and do not use a post-coffee reading as your baseline. Fourth, ask your doctor for clear missed dose instructions for each medication because the rule is not always the same. Fifth, ask whether your blood pressure pattern suggests you might benefit from ambulatory monitoring or a different dosing schedule. And finally, track your blood pressure like a scientist, not like a frightened patient. Same arm, same time, 5 minutes of rest, no talking, no rushing. Bring the log. Let the pattern guide the decision. Your blood pressure medication may be one of the most important tools protecting your heart, brain, kidneys, and independence. But a tool only works properly when it is used in the right way at the right time for the right body. And your body after 60 deserves more than autopilot. It deserves attention. It deserves adjustment. It deserves a real conversation. If this video helped you realize something you were never told, share it with someone over 60 who takes blood pressure medication. And in the comments, tell me your age and which mistakes surprised you most. Coffee timing, late diuretics, grapefruit or salt substitutes, missed doses, or the question of morning versus bedtime dosing. I read every comment. And please remember, this video is educational. It is not personal medical advice. Do not stop, start, double, skip, or move your medication without speaking with your own doctor or pharmacist. The goal is not fear. The goal is better questions, safer routines, and a heart that stays protected for as many years as possible.